You know, there's actually people behind the scenes somewhere at a big boardroom, and they're talking about this. They're saying, how are we going to get physicians to buy our drug or let us into the office? And somebody's saying, I got it.
Drug representatives are all very educated, very personable people, and they're wonderful to interact with, which is, I think, part of the problem.
Each pharmaceutical reps are in charge of different regions in the United States, and those who are considered high-selling areas, actually, they get a bonus or they get a free vacation. So there's a lot of incentive for them to market pretty hard.
The sales reps know about the prescribing practices of the doctor before they come in to see them. The personalized prescribing information, where the sales reps get it, it's sold by pharmacies. And it's sold to large market research firms like IMS Health. And then they sell it back to the companies.
Sometimes they'd come in and say, well, let me look at your cabinet and see what's kind of missing. Oh, it looks like you're not prescribing very much of what we've given you. Is there a reason for that, doctor? And I noticed my competitor, they're selling more, and why is that? Or they'd even do some crazy stuff like they would actually move their product in front of the best-selling one. That's what they're taught to do.
My brother, as a pharmaceutical representative, has used multiple techniques to try to get his medications prescribed. It ranges from pens and t-shirts and pads to lunches. He took a neurosurgeon out for a lunch at a fancy hotel in Seattle recently, to trips to Hawaii for those prescribers who are kind of his top-end prescribers.
And it's not limited to lunches. I mean, it's stuff such as, hey, how many do you guys maybe need some blood pressure cuffs around here? Hey, I've noticed that your treadmill is kind of breaking down a little bit. You know, I think we can, I know some people.
There are a range of marketing techniques that are very commonly used. The technique of giving small gifts, for instance, to physicians, even to students, to medical students.
A lot of the pharmaceutical industries hire psychologists that go in and evaluate what is the effective way to change somebody's behavior.
Many of the techniques, even if you know about them, that's not going to enable you to turn them off. For example, we know that people are more likely to remember the name of a drug if it's repeated often. So you can teach people that, but that's not going to stop it from working.
Some of the techniques they use are to talk about your personal activities. What do you like to do? I myself then start talking about different sports and activities. Then they are like my friend.
The companies want to build relationships with people because it's harder to say no and it's easier to say yes.
Once they develop that friendship and then they give you a gift, you sort of feel obligated, and that's just human nature. And then you feel, well, maybe, you know, they're my friend, they're not going to steer me wrong, maybe I should prescribe this drug. Maybe it is really better.
You have pharmaceutical representatives go directly to the physicians and promote their drug by talking to the physician about the benefits of the drug and what they perceive are the side effects of the drugs and how their drug compares to other treatments. And often drug samples is kind of a nice way to gain entry into doctors' offices and allow them to have access to the physician.
When I've spoken with doctors about this, they often say that the reason that they'll see sales representatives is because they want to be able to get the samples which they can then provide to their patients. Really, it's market seeding, like sampling in other kinds of sectors would be.
Accepting free samples is also sort of opening your door to pharmaceutical representatives and influence and things like that.
I really actually have a different feeling than many people. I think free samples are okay. I believe for my patient, I have to find every avenue to get them their medications.
Free samples seems like a really good thing, right? You're getting a free medication to a patient who can try that medication and see if it works for them. But in reality, you're giving a much more expensive medication than the patient may need because it's free and it's there, instead of necessarily the right medicine to give to them.
I think the downside of free samples is that you give out a sample and the companies wish that you will send them with a prescription, so they take it for 5 days to make sure they don't have a side effect, and then they fill the prescription.
The problem is that if you are accepting samples, then you're accepting a gift.
Because Harborview is a public hospital, the population that we serve is primarily a vulnerable and indigent population. We have 30% that we do charity care, another 30% Medicaid. The research project that I did on drug samples, it started because the clinic that I worked at had drug samples, and there was discussion of whether or not drug samples should be removed. The advocates who wanted to keep drug samples felt that it was beneficial to patients because it offset the cost for them and it provided free medications for them. But those who were against the drug samples felt that it was very difficult to store the samples properly and also be compliant with documentation and distribution of drug samples. There were also other people that were concerned that drug samples adversely affected physicians' prescribing patterns, and so that's what prompted us to conduct the research study. We gave 3 scenarios for physicians to see whether or not the presence of samples influenced their prescribing behavior. And we found that in the presence of samples that physicians actually, a proportion of them prescribed a drug that they would not normally prescribe.
There was one study that looked at the effect of free samples on the prescribing patterns for antihypertensive drugs. In my view, the first-line agent should be low-dose thiazide diuretic. Thiazide diuretics cost about 60 to 90 cents a month, so there's almost no point in providing a free sample of a thiazide diuretic. It's less than a cup of Starbucks coffee. A month's supply is. In one clinic, they banned the free samples, and the compliance with the first-line antihypertensive drug went from about 30 or 40% up to 70 or 80%. So the free samples actually worked to put people in that clinic on drugs that were not preferred and were expensive and were on patent.
I came from a practice where we did use samples, and we had a whole cabinet full of them. And the people I used them for were people who financially couldn't afford the medications. If I had a whole cabinet full of Zoloft, and I needed to start somebody on an antidepressant, I started them on that, thinking, well, if this works well, we can always change them to something else. But the reality was, then if I did prescribe it and they were happy with Zoloft, that's what they stayed on.
And in medicine, I think many of us are inertial prescribers. If somebody comes to us on a drug and they're well controlled for their blood pressure, their lipids, or their diabetes, there's a tendency not to change. So starting someone on a drug really can commit them to an entire life of treatment on that drug.
Dating back to when I was in rural practice in a community health center, essentially pharmaceutical reps would come to our office, and it was an advantage because they supplied us with lots of sample medications, which was terrific for our population because it was an underserved population who couldn't afford them. And so it was one way to be able to deliver those medications to the patients who didn't have the dollars or needs.
At the clinic, we serve children, of course, and it's diverse. Socioeconomically, a good proportion of the families we serve, 70–75%, are low income, often on Medicaid or Medicaid eligible. And a lot of the families have to make pretty difficult choices sometimes between food and rent and medications and things like that.
Sounds good.
What usually happens is that the free samples are usually the brand named or the newest, latest drug. And what never gets sampled are the tried and true generic drugs.
And then when you try to tell a family that this other generic allergy medication works fine, and this is usually what we start with, and this is what I would normally prescribe, they say, no, I was on, brand X that you gave me that sample for, and I want to continue with that. So I think it's a strategy that is pretty clearly effective.
A lot of the free samples actually get used by office staff in the doctor's offices where they're placed. And so in essence they amount to a gift from the drug company to the doctor and his office staff. That's not supposed to happen, but there have been some studies that show that it's pretty clear that these drugs get widely used by the office staffs, and in essence it constitutes another gift.
I realize that the pharmaceutical drug companies, their goal is to sell or have doctors prescribe as many drugs as possible. But our job as physicians and the medical community need to be responsible and know the evidence and appropriately prescribe medications that are safe and effective for patients.
I don't use them. I think that if I was to use samples, that means I'd use what was there, which tends to be the more expensive drugs, so that's more costly for my patients in the long run and not better. And when I'm starting a new drug, I like my patients to have to go to a pharmacy, because then the pharmacist double checks in case I'm making mistakes. So that's a protection for my patients and it's a protection for me.
Drug samples is also a practice that we discourage in group health. You have to have a very sophisticated integrated system in order to manage drug samples. And if there is a drug recall, how would you be able to get a hold of all those patients that you've actually given samples to? It's also very hard to monitor drug interactions.
Really the downside of giving out samples, if you're giving a year at a time, is the physician time. It takes time to get those samples. Talking to the pharmaceutical representative, it's a way they get into your office. It's a way that they have access to you, so that there's a payment for those samples. Nothing's free.
Drug samples reduce costs in the short term, but I think ultimately the societal costs are greater, because you ultimately will prescribe that medication that you dispensed as a drug sample, which is often more expensive than a first-line treatment or a generic drug.
We've actually cut it down to almost no free samples, because it's so hard for me to figure out how to make a good choice about that doesn't really place me in an ethically questioning kind of position.
We removed the drug samples from our clinic, and what we've done as alternatives to drug samples is actually have a patient assistance program where we provide medications for patients at lower cost or no cost if they can't afford it. Other clinics have actually used pre-packs of generic medications in the clinic so that they could still provide medications for patients immediately.
The American Association of Medical Colleges has recently come out with a task force report that has a number of recommendations that are quite useful. One, regarding the samples, is that the samples come to a central repository rather than a clinic, like the central pharmacy, and are distributed there.
There's many physician organizations that are involved in this plight already. The National Physicians Alliance is one of them, and they're the ones who are responsible for, even at the federal level, of trying to introduce bills to prevent this pharmaceutical influence.
I had a student a few years ago that had a big influence on me, and I think the thing that influenced me the most about it was the fact that the student, had very strong opinions, but also was somebody who looked at all sides of an issue and listened to everybody.
I sent him an email after we had a drug representative come to our lectures. They used to come and supply donuts for the medical students in the mornings every week. I spent a lot of time writing that email. I spent a lot of time researching, because I think as physicians we want to be empirical and we want to be very scientific about all of our decisions. I referenced some articles that I had read about drug companies and how they were influencing physicians, and how physicians were often oblivious to the fact that they were being influenced by free lunches and teaching and free samples. When you break it down, it all comes down to patient care. The person who pays that price is our patients.
And I think really stimulated me to look even more into the issue of influence by the pharmaceutical companies, and the role it had with my own career and also in medical education. So I learned a lot from my student.
And I think the nice thing about being a doctor is that people generally think that you have integrity with what you're prescribing. And I think to some degree that's why the drug company argument becomes so profound, is it sort of, in a sense, undermines our integrity. It could potentially undermine the physician-patient relationship. And one could even say, based on the evidence, perhaps it should help implement change.
If we draw the drapes back and our patients are watching everything that's going on, would they be as comfortable with what's happening? And would they feel that that's all in their best interest?
The responsibility is actually on us to recognize the influence and be aware of it, and put up safeguards so that we don't prescribe inappropriately.